Welcome back from our intermission. Our panelists and speakers are ready to answer your questions, so go ahead and put them in the chat. Now, let's meet our panelists. Kelly, why don't you kick us off with introductions?
Hi guys, I'm Callie McGuire. I'm a senior at Florida Gulf Coast University.
Good morning, everyone. My name is Chantel Rhodes, and I am a child advocate at Golisano Children's Hospital.
Good morning. My name is Sherry Wenzel, and I'm the coordinator for mental health services with Lee County Schools.
Morning, everybody. I'm Paul Simeone. I'm the VP Medical Director of Behavioral Health at Lee.
Hi, I'm Zoe. I go to Fort Myers High.
Hi, I'm Megan. I also go to Fort Myers High.
Hi, I'm Cass, and I go to Fort Myers High.
Hi, I'm Abby, and I do not go to Fort Myers High.
Okay, everyone, thank you for your introductions. My name is Megan. I work for Park Royal Hospital. I'll be managing the questions in the chat today. So we got some questions rolling in here. Some are directed to our panelists, and some are just general questions. So feel free to just chime in as a panelist. Our first question is from Jessica. She says, I'm working with a group of girls. We have several conversations, mostly about bipolar. Parents have many questions. What would you say to help parents with understanding bipolar disorder?
Well, I was wondering whether or not the person who talked about having manic depressive illness, which we now call bipolar, wanted to speak to that. You want to speak to that? I'm happy to yak after that. Go ahead, Kev.
Yes, I do struggle with manic depression or bipolar. To parents, I just really think it's the patience, because bipolar a lot of the times is what it seems to be. It's bipolar. It's the ups and downs, the constant 0 to 10 with no in between. So to say to parents, I just really think that patience is the key. Like if, your kid is snapping and you notice it, just maybe taking a step forward isn't always what you have to do first. Sometimes you have to take a step back and see it for how it is and start from there and just be patient.
Absolutely true. What I would add to that is that I think what's essential about understanding anything having to do with behavioral health or mental health issues is education. I think there's a lot of information out there these days on bipolar illness. And bipolar illness has a lot of varieties. It's not just straightforward bipolar. There are many different variants that show up in different ways. What's also important to understand is that most people who are bipolar spend 90% of their time on the depressed end of things, with added levels of irritability and it's often a lot of irritability until they actually are manic. And a full manic episode generally includes a psychotic episode where people have a lot of difficulties with reality testing, delusions, hallucinations, that sort of thing. The other thing I would recommend, so just back to the resources, there are lots of really wonderful websites out there. When I want to know something, I generally go to the Harvard Medical School website or the Mayo Clinic website. Those are very reliable sources. The other thing I would recommend is getting involved with the National Alliance for the Mentally Ill. I'm on the board of the Lee and Hendry and Glades County one. We're having a walk upcoming on October 5th. And so I just want to put that plug in. The National Alliance for Mentally Ill is a wonderful organization started in the 70s by a couple of women who had sons with schizophrenia. And it really is about advocacy, education, providing support, and helping people to understand what the challenges are and providing a sanctuary for people to talk about it straightforwardly and without any kind of discrimination. So there are really a lot of resources out there. And of course, if there are, mental health professionals involved, you want to make sure that they know something about bipolar disorder, because not everybody really, not to be truthful, not everybody does. And just ask them how they understand it and what the best way they think about treating it. So I hope that helps.
Great answers. Thank you for sharing those resources. We'll make sure to get those in the chat and the plug for the NAMI walk this October. Cass, thank you for sharing that insight. It's very important to have those lived experiences to relate to. We have another question from an attendee. This one's for Abby, actually. I am so impressed with your journey and your courage to share it. What do you recommend for educating parents? Also, how do you find that horses would help you?
For educating parents, I just really think that they, well, like turn to Google and your child's therapist, figure out what's going on with your child. Don't always like brush it under the rug or, oh, they're just depressed. They're fine. Because most of the time they're not really fine. Horses, it's a great therapy thing. Like, I don't know. I just find so much comfort in my horse he's always there for me. It's the one animal that's never really judged me, I guess. So there we go.
Wonderful, great. Do we have any other input from our panel on equine therapy and how that can help students? So we have Beasley's Paws in the room, and although they're not horses, I did want to give a shout out to our therapy dogs that are actually here today.
Yeah.
Does anybody want to, chime in on the use of pets and animals to help with our students' mental health?
Megan, might we have somebody from that organization to talk about that? It would be really great. Yeah. Thank you.
Oh, bless your heart. My name is Donna Herbst, and I've been doing therapy dogs, working in therapy dogs for over 14 years, and actually started the Lee County School reading program with the dogs. And I actually got out of dogs because I had some joint problems and couldn't ride horses anymore. So I had big dogs. I had a Newfoundland and a Great Pyrenees. And all of these animals, they give unconditional love. They are non-judgmental. And even as a nurse also, I find that children and people will communicate with the animals before they're going to communicate with another person. They will open up in their own way and over time become more comfortable, because the petting and the being one with the animal is just amazing. Like the young lady that rides, there's a strong bond. And I read with children that were deaf, and you're like, what? Well, yes, I had someone that signed for me, but also they had other problems that affected them, medical problems. And they would just sit quietly, even a classroom with children that had autism. They would just quiet down immediately for the animals. And I think over at your hospital, on and off, with the children, you've had the therapy dogs come in, and you see the power of healing. I mean, we even go to detox centers. We do every kind of help. Courtrooms are taking us in now, everything. So it's really expanded where people can start to function. So.
Thank you very much for that. Yeah, go ahead, Chantel.
We just moved to Florida from North Carolina, and my wife was involved with the Lee County Health and was at a session where they had therapy dogs, and we thought Moses would be a good therapy dog. So I registered and got him. And so this is our second visit. So thank you very much.
We're delighted to have you. Thanks for coming.
Speaking of therapy dogs, I turned on the news last night and Golisano's very own Dorian, they had like a special feature on Dorian, not just providing hope and healing to the patients in the hospital, but also for staff. It is a joy going to work every day, just knowing that Dorian will be there, kind of hanging out around my desk, waiting on me to drop some lunch or something, so that he can snag a bite of it. But animals in general are just great. So thank you for sharing your story.
Thank you so much. Thank you so much. All right, we're going to move into our next few questions here. We have a lot of questions
Thank you.
rolling
Thank you for
in.
coming.
Thank you so much.
It's wonderful that you're doing this. And there needs to be more of it, really.
Yeah. Well, thank you very much.
Thank you.
This question is for Megan. Megan, how would you say to your fellow peers about seeking mental health support?
Oh, I've actually had to do this quite a bit, as for some reason I seem to find friends a lot that share the similar experiences to me. I guess I attract people that are similar to me, but it's what I do first is I share my experiences with them because a lot of them are mostly hesitant about medication. Unfortunately, a lot of the time it's also parents who are hesitant about getting any kind of mental health treatment, trying to just ignore it and hope it'll go away. It's a matter of one, getting the parent to work with you, and then two, what I do is I try to help. I recommend the places I go to friends, and may I plug in a name? May I plug in names? So I personally do Elite DNA for psychiatry and Center for Psychology for therapy. So I recommend places like that. And then I share my experiences with medication. It's not always 100% immediately going to work. Sometimes medication stops working. But I always urge the ones who do need it to do it because it's worth it. And if they're hesitant about medication, try therapy first. That's what I did. And then it just didn't work. And if therapy doesn't work by itself, add medication, try it. It's a matter of just looking for what's the right combination for you, truly. Because everyone's brain is different. Everyone's brain is built different. Though if you have family, it might work a little similar between you and like a parent. So I say do it, especially if you have like the financial ability to, because I recognize that's an issue. And yeah, those places that I mentioned are good.
Thank you so, Megan, you put that beautifully.
Thank
And
you.
really painted the picture of how recovery can be a process, right? And we may hit some dead ends, but there's always help available. You gave some really great practical resources as well. But the most motivating part of your message is really that you just keep going, and it could be a different combination. So thank you for putting that into words for us.
Megan, I
Thank you.
just want to echo one thing that you said, which I thought was really brilliant, which is that, many of these disorders these days end up being treated by a combination of medications and psychotherapy. And the outcome literature is clear that that combination produces the best results over and over again. So we've known that for a long time. I think oftentimes people get stuck with an early recommendation for medication. And lots of people are leery for very good reasons. They don't know much about it. There are some side effects that are problematic, et cetera, et cetera, et cetera. So I think starting with therapy makes the best sense because it's in the context of that therapeutic relationship that people feel more comfortable discussing medications. I've been a practicing psychologist for nearly 40 years, and I've just learned that over time, when I start talking to people about medication, I have to have a relationship with them first. I have to speak to the parts of them that are self-protectively leery and respect that. And oftentimes, it's the development of a therapeutic trusting relationship that allows that conversation to go on in a way that otherwise wouldn't occur, which is, oftentimes it happens in a pediatrician's office or a primary care doctor's office. They're going, a million miles an hour. They don't really spend enough time getting people ready. And so people have a knee-jerk reaction to say, no, I'm not going to do that. So I think it's all about developing the relationship first and then locating that conversation in that comfortable place. Thanks.
Great. Thank you so much, Dr. Simeone. Is there something that the school district has or offers that will help parents and families navigate those different appointments?
That's a good question. Thank you. Yes, we do have school-based mental health professionals that parents can absolutely reach out to on an individual basis, which include our school counselors, our school social workers, our school psychologists, and our licensed mental health professionals that work for the Lee County schools. But also we have what we call Wellness Wednesdays for parents, and that is where we do bring in outside experts to discuss some of these things that mental health issues that are challenges that our students are experiencing. And a lot of times our parents and that's why I was so empowered today by everyone when you spoke, when you really truly spoke to the parent and said to them, this is what I need. In fact, that is going to be the topic of our October our Wellness Wednesdays for our parents, is really assisting our parents in supporting their students and their children, because we've had different topics on anxiety, on depression, and what that looks like in your student. But what we often hear from our parents during those sessions is, what can I do? How can I support my child? Because as a parent, that's what we do. And so I was really, really impressed. And I was so excited to hear all of you talk about the roles that your parents played in your journey. And that is such an important role that parents play. And so those are some of the supports that we not only provide to our students, but we can also support their parents as well.
Thank you, Sherry.
I'd like to add something to that. I know you spoke specifically to the school district, but through Kids Minds Matter, Golisano Children's Hospital offers a variety of parenting classes on dignified discipline, nurturing parenting group. We have our weekly parent support group. And basically what we try to do through those classes and those support groups is help parents understand their child's diagnosis, talk through some of those tough times, some of those behaviors. We have Richard Keelan, my supervisor, who is just an excellent clinician overall. And he comes in and provides information for parents seeking help understanding IEPs and 504s and what options are available to them throughout the system. So just plugging that in there, leehealth.org/classes.
Wonderful. Some really great resources for our parents, which is a perfect segue to our next question, which was kind of answered actually in some of your answers. But what can an adult say or do for an older teen who is scared to get help because they don't want to be diagnosed and they do not want to take medication? There is a history of mental illness and medication abuse in the family?
So personally, I can understand that because my family has never really been big about medication, more natural stuff like that, a little bit hippie, you know. But medication can be a great tool. Therapy can be a great tool. And I understand not wanting to be diagnosed, because then it makes it real. It makes it part of who you are, which necessarily doesn't always feel like a good thing. You don't want to be represented by anxiety, depression, bipolar depression, whatever it is. You don't want that to be who you are, but it's not. It's part of who you are, but that's not who you are, if you know what I mean. So, I know it can be very scary, but as I said in my speech, getting a good support system, educating yourself, having your family educate themselves can be a great tool to figure out the path that you want to take. And medication doesn't necessarily always have to be the only option. Many people thrive on solely therapy and stuff like that. So even though medication and therapy can be a great tool when put together, it doesn't have to be that way for you. I wouldn't necessarily suggest doing medication without therapy, just personally for myself, because combination works better most of the time. But if you are uncomfortable doing medication, which is totally understandable, especially if you have family members with a past of drug abuse or anything like that, therapy, just starting with therapy is great. And if you're afraid to start therapy, it's okay, because I understand. I absolutely hated therapy before I found the right therapist. It can be scary and you can be untrusting. You're talking to a total stranger about very vulnerable things. But you have to understand that that person is there only to help you. And once you find that right person, it can be an amazing tool with medication or without it. So honestly, if you just keep an open mind and give it a try, you could find that it could be really beneficial for you, combination or just therapy.
I'd
Wonderful,
like,
great.
oh,
And did you want to jump in on that?
yeah, I'd
with
just
that,
like to
Megan?
add on a little bit on the whole diagnosis is like just a part of you thing. I've always thought of diagnoses as just a way to inform you of why you are the way you are and why you're acting the way you are, so that you can arm yourself with the tools to properly combat any of the negative effects of it, and also learn about how to utilize the positive effects properly.
That was beautifully put, Megan. Thank you.
Megan, I just want to say something. I was going to say something similar about diagnosis. I think in behavioral health, psychiatry, clinical psychology, there's too much emphasis on diagnosis because nobody wants to be labeled by anything, frankly. I mean, we've heard a lot of things today about how important not only to tell your story, but to have it accepted as your story. And diagnosis often cuts right into that because it's not experienced as part of your story, right? So I when I was practicing in Boston, I saw lots of adolescents I love seeing adolescents. And what I would say to them is I couldn't care less about the diagnosis. I'll tell you what I think is going on. And if you want to line it up with a diagnosis, it's okay with me, but that's not going to drive anything. And then the other thing, just in terms of how to talk with people about this, I always start with what's important to them. It's not about what's important to me. It's important to, so, about, people to often talk about motivational interviewing, which is really just a technique to suss out with people what's important to them and what they're motivated to do on their own behalf, not for somebody else. And so I think if you start the conversation there in the most respectful way, taking into consideration what people bring to the table, I haven't had a lot of trouble with that conversation for the most part. So anyway, I just wanted to say that. Thanks.
And it sounds like the Wellness Wednesdays the parent talks that you were speaking to earlier, Sherry, would be a great forum for parents to come and ask questions on how to speak to their young adult that may be struggling.
Absolutely. And that's one of the goals of Wellness Wednesdays for parents is to educate them and to support them.
Wonderful. So, education sounds really to be the key to getting that stigma away from having these conversations. So we hope to see some of our participants at these wonderful talks that are going on through Lee Health and the Lee County School District, Kids Minds Matter. We do have another question around, and this one's actually for Kelly. How do you overcome your thoughts about body image? When you said you were struggling with the way that you saw yourself, how did you overcome that?
To be honest, body image is still a big issue for myself. I think, as I talked about in my speech, healing is a huge process and it's not something that really just goes away. A lot of the struggles I shared, I still struggle with today. I think it's more about accepting that you have those struggles and really like being okay with asking for help and being okay with not being okay. Um, like specifically regarding body image, I think one particular self-care that I've actually started is just putting lotion on my legs, which sounds like maybe a little strange, but as I do that, I actually say positive affirmations to myself because for so long with the trauma I went through, I really just neglected my body, didn't pay attention to it. And so that's like a huge step for me is just learning to validate and accept like my body for what it is. But like I said, healing is definitely still a process and something I'm working through.
Great. That was a really great example of self-care and mixing that positive affirmation in with that. Thank you for sharing that, Kelly. So how can teachers be more supportive? And I guess so this would be more for our speakers today. What do you want to see from our teachers? How can they be more supportive? Would you say looking out for mental health struggles like these begin in middle school? When did these begin for you?
Hi. So teachers can really help by being more supportive by like again, as said in one of the speeches, understanding we have a life outside of school too. Um they can't like me with my Tourette's. I'd make noises and they thought I'd like be distracting and trying to distract kids. Try to understand what your peers and students are going through because it's not all black and white all the time. They might be struggling with something that you don't know, like they don't turn in their homework. They could be depressed or have a bad home life. You don't know what's going on in their personal life. And you just really have to be open-minded about what could be going on outside of school.
Just to add on that, I talked a bit in my speech about what teachers and school staff can do. I think honestly, it's just important to look at your students as people because that's what they are. They are not just your project or your job. They are people with real feelings, real emotions, and real struggles, just like you guys have, like all you teachers have. And there's been times where teachers will have like mental breakdowns in class and they'll cry and they'll have a bad day. And the students are so understanding and they try to help and they try to comfort and they try to understand that teachers have bad days. Like just because they're adults doesn't mean that they are perfect 100% of the time. No one is. So I think it's just important for teachers to give students that same respect and understanding because we are people too. We have bad days as well. And as I said in my speech, kids don't have the skill sets like adults do. Children, especially young ones, they don't know how to express their emotions, which is for me especially a lot of the reason why I was the problem child. I struggled a lot. I was a real pain to my parents most of the time, but mostly because I didn't know how to express how I was feeling. So if you try to just educate yourself as teachers and even parents too, if you just try to be more understanding, educate yourself on different mental health issues and disorders and anything like that, and understand that we have a life outside of school. We have our own struggles, just like you, but we're not as equipped to handle them as you are. So that's why it seemed worse with us than it might with you.
Thank you for that. And when it comes to teacher education and mental health, Sherry, did you want to share a little bit about what that
turned my
looks
mic
like?
on. Is that yes, absolutely. And I think I just want to say, what you say is absolutely, we want to support that. And everybody goes on a journey. And you're right, you guys are on a journey, and also the teachers and the staff and the school personnel. We all have our own journeys, hopefully outside of the school environment. And that's really important. And we as a district have really started focusing on educating not just our teachers, but all of our school-based staff, whether it's custodians, bus drivers, administrators, cafeteria workers. We want them to have a better understanding of not only the struggles that you go through, but have some insight about their own struggles and their own journey. And we do that through education. We offer youth mental health first aid training to all of our staff. And we've probably trained over 4,000 of our staff right now in that, and not only recognizing students and children who are having mental health struggles, but what to do with that. Because believe it or not, our teachers are there, they're teachers. They're there to make sure that you have an education. And just like mental health kind of has a stigma or is kind of scary for you when you're experiencing it, and for parents as they're witnessing it in their children, it's kind of scary for our teachers too. And it's scary for our administrators because they want to help you, but they don't know what to do. So we really are in a process of educating our staff on what that is, how to recognize it, and how to support you as students better.
Thank you for speaking to any of our.
Can I just add something real
Yeah,
quick?
absolutely. Go ahead.
I believe that like that's really good. Like that teachers are being taught how to deal with it better, because when you think about it, it's like, yeah, it's not in the job description, but as a teacher, when you sign up to do that, you sign up to meet all kinds of people, all like from many walks of life, different experiences, kids that have gone through things. And, even the teacher comes alone with their own story and their own problems. So also at the same time, while educating the teachers, we also have to have the patience with the teachers and understand that, maybe they don't understand it and they were brought up differently to believe other things.
That's right. Thank you. And that's a very good point. And like I said, and you're very well aware, we all come to the table with our own experiences, and how we interact with each other is based on the experiences that we've had. And so it's just learning to support ourselves and each other within the educational system. And like I said, it's a journey, and it's where we're working very hard to work with everybody to make sure that everybody feels supported, because this, especially now during the pandemic, and I really, really do want to say that I appreciate those that shared their story about the distance learning and the impact it had on them, because I want to share too that, a lot of that happened also within our staff members. So some of the same feelings that you were feeling during distance learning, we were hearing a lot of that from our staff members as well as in the teachers. So we're kind of entering this area where nobody knows what to expect. So we're all working together. And I think that's important, that we continue to reevaluate, step back, see what works, see what doesn't, and try again. It's just like anything else. But what we want everybody to know is that we are here to support our students and our staff to make that journey be successful for everybody.
Thank you, Cheryl. Thank you, Cass. And as a youth mental health first aid facilitator, actually, I can speak to the effectiveness and what a great program that is. If you are on the call today and you are interested in getting certified in youth mental health first aid, which is an 8-hour course, any parent, teacher, anyone can take it. I believe courses are offered through Kids Minds Matter. Is that correct, Chantel?
Yes, I believe that course is valued at around $170, and we offer that for free. Again, leehealth.org/classes. We offer mental health first aid, and we also offer the youth module. We also offer it in Spanish. So take advantage of that, because you will receive a 3-year certification that you can take anywhere. It is an outstanding class. Even people that work in the area of mental health, they walk away from that class and say, wow, I didn't look at it this way, or I didn't consider this. And one of the things we talk about is language, and how language it can contribute to the stigma that is surrounding mental illness. So yes, $170 course, absolutely free through Kids Minds Matter.
So I took the youth mental health first aid and mental health first aid with Kids Minds Matter. It's an amazing course. Also, any youth are allowed to take that as well. So high schoolers, middle schoolers, I think. Definitely take the course. It's worth it.
Perfect. Thank you so much for that. Well, at this time, we have a lot of questions rolling in virtually. But today we actually have a small audience in the room of supporters, and we want to open it up to the room here today for anyone that may have questions.
Thank you. I'm curious about your class. Is that sorry, he wants to go visit and do his job. Is that an online class, or is that in person?
At this time, we are offering it online, primarily because of the rise in COVID cases, but we
Correct.
do offer that in person as well, but at this time, just virtually.
Actually, it would be better for me online, so I can incorporate that into my therapy dog volunteering, as well as my work as a nurse. So it's a win-win.
There it is.
Thank you.
being on this panel, I think that why does Lee County see it as an option for teachers to go through mental health training instead of a mandatory mental health training?
It's not an option to go through it. It is mandated by the Department of Education at the state level that all of our staff members be trained in youth mental health first aid. We just have a lot of staff. So it takes a little while to get through all of them, but we are slowly working towards getting all of our staff, which is required by law, to be trained in youth mental health first
What
aid.
percentage is Lee County at now?
I cannot tell you right at this very moment. I apologize for that. I don't have that statistic right in the top of my head, and I don't want to give you the wrong answer.
Hi, thank you very much for being here today. Quick question. Are we rolling out some of this for the younger students? As we've heard from a lot of the speakers today, a lot of this happened when they were very young and they didn't have the words or the capabilities to express it. So a lot of these programs, it sounds like it's more for middle school, high school. Is this something that's going to be rolled out so that when students come into Lee County and through, the hospital and other Kids Minds Matter, will there be access for younger children so that this will avoid, not necessarily avoid, but it will just be normal to have access to this from a young age for those who need it?
That is a really good question. And thank you for asking that, because that's just what I was talking about earlier, is within our schools, we do have our social emotional learning that we provide. It starts in elementary school. It starts with teaching our students how to ask and how to talk and to identify those feelings, because like they said earlier, when they were younger, they didn't even know what it was. They didn't know what that feeling was, and they couldn't verbalize it. So we really do have a curriculum that starts in our elementary schools there, where we teach and we support our students in identifying those feelings and being comfortable talking about it. Because a lot of what was shared today is that there is, that stigma, but we are really working, starting in the elementary schools, to kind of educate our children on the importance of identifying and talking about those feelings and knowing what to do with some of those big feelings. And when I work with young children, I always say, they don't know how to verbalize those big feelings. They don't know what it comes out in different ways. It can come out in anger. It can come out in physical aggression, verbal aggression, or withdrawal. It can go either way. And so it's really important that we educate and support our youngest children in learning that it's okay to say, I'm mad right now, or I'm sad right now. And what does that mean? Because sometimes when you work with those younger children, they don't even know what that means. They know what sad is, but they can't really recognize it in themselves. So we are really working across the curriculum, and we are implementing that within our schools. I hope that answered your question.
Just to add on that, not necessarily for Lee schools and stuff like that, but for parents, I babysit specifically 2 wonderful little girls whom I love dearly. And, kids, especially parents, there's a lot you can do too for your young children. Normalize, talking about your feelings and validate their feelings. If they're upset, it's not always the best idea to put them in a timeout. Talk to them like they're a normal human being, because children are a lot smarter and a lot more aware than you think they are. So if your child is mad and they're screaming and they're yelling, if you just put them in timeout, that's not doing any good. You sit them down, you talk and be like, hey, can we try using our words and talking about what's making you upset right now? Validate their feelings, come up with a solution that works for both of you instead of ignoring it because it's an inconvenience to you. You have to support your children from a very, very young age, because there could be a lot going on in their head that you're unaware of, especially since young children aren't the best at expressing their feelings. So when you are able to validate their feelings and work with them instead of with yourself only, it can be a huge step into normalizing mental health support within young children, along with what will be going on or what is going on in schools and stuff like that. So when you reinforce those things at home, it can just create such a positive space for them to feel comfortable enough to talk to you. Because I know when I was younger, I was so afraid to talk to my parents about how I was feeling because I didn't want to be an inconvenience. Because, a lot of the times parents will put you in timeout or they won't want to deal with you and they're just sick of you crying and they're sick of you just being a pain, which kids are. I mean, they are, but they can't help that. They can't like have a different personality for social situations. They are who they are. So when you're able to support them at home along with in school, it creates such a great positive area for them to be in mentally and physically. And it normalizes, being okay with talking about your feelings and not always being okay, as Abby said, which I love that motto. So just again, the support, understanding, and just trying, doing the research, and parents and teachers, school, there's already great programs going on with schools, but you have to do your part at home as well.
Hi, can I just add a little bit? I think it's great that they're making programs and starting to educate younger children about different mental health and how they're feeling. Because I remember when I was little, I didn't know why I didn't have friends. I didn't know why people didn't like me. I didn't know why teachers always thought I was such a problem and would send me to other classrooms because I was just being myself. I was just trying to be little 5-year-old me, and people were always so angry and didn't want to ever cooperate with me. I think it's really important to really stress to younger people that it's okay to have accommodations, and not everyone is the same. We all have different problems. We're just trying to have a good time.
Great answers, everybody. Thank you for your questions and for being here today. I do want to make a correction too. We are talking a lot about parents and educating parents, but what we really mean is parents and caregivers. So thank you, Kristen, actually, for pointing that out today, because some students have guardians and other caregivers who nurture their growth as opposed to parents. So thank you for that shout out to all the caregivers out there who engage. Moving into some of our other questions here. This event is a great opportunity to reduce stigma about this sensitive topic. What else can we do as a community to go beyond today to keep this conversation going?
Well, so this annual event inspired a weekly group that many of our students participate in. How many of you have participated in our Tuesday night class, Kelly? Yeah, so every Tuesday from 5:45 p.m. till 7 p.m., we meet in person at the Quality Life Center of Southwest Florida. If you cannot meet in person, we also offer that virtually. We send out a Zoom link. And you can connect to that Tuesday night group. And what that is basically for students to come together to support each other. They are students who identify as having mental health challenges. They get a free meal when they come to the Quality Life Center, and it is pretty good. But it is a time for just students to come together, support one another, talk about what's important to them, and to keep the youth voice uplifted in the system of care. Continuously saying, we are here, we want to tell our stories, we want to share, we want to educate people. Dominique had a great idea to partner with the school system and just trying to educate parents and staff on the process of being hospitalized through the Baker Act, because that is something people really don't understand. So that is just one of the many ideas that comes from this group. It is a newer group, and we're looking for more students to join that group.
Just to add, since I do attend quite a few of the meetings, I was actually told about the meetings by Carly, the lovely woman who started this event. And the first time I went to it, I wasn't really sure what to expect. And I was like, oh, this is gonna be kind of cheesy. I'm gonna leave here like more depressed than I came because it's gonna be all about all the crappy stuff we go through. But it's actually a really uplifting group. And like when I talked about in my speech how students will thrive in a more communication based environment concerning mental health, and the meetings are a perfect example of that, because I always feel so much better leaving the meetings than going into them, because I'm able to express myself and relate to people around my age, people that I can relate to, and people that I know support me. And I know a lot of kids they don't want to talk about it because they're worried about getting judged. But this group is so supportive. The people that attended, Chantel, Deb, everyone, Dominique, everyone is so supportive and so kind. And it's definitely just a great thing to just be a part of. And I know that me and Cass really love it. And it's a great way to connect with people and understand more and kind of get more insight outside of yourself, because I know I learned a lot about mental health once I started going to the meetings, simply because it just wasn't a topic introduced to me as much outside of my own experience with it. So it can definitely also be an opportunity for education if you don't necessarily struggle with mental health issues. If you're a student and you want to be able to be more supportive or understand more what your peers might be going through, it's definitely a great thing to go to. And it's a great thing. And the food is really good.
That's great.
I can attest to the food. It's good.
If I may add a little more onto that, I was also thinking about a little bit, taking a bit from what you said with the parents working with smaller children in normalizing like emotion, like speaking about emotion. And I try to apply that also myself to my everyday life in being more honest and open, and just if someone judges me, that's their problem. So I'm going to be honest and open about how I'm feeling and what I'm struggling with. If I miss, for example, band practice because I'm on the verge of a breakdown, I let my friends know, hey, I'm going to cry if I go to band practice today. I'm going home. I let people know how, if someone asks how I'm doing and I'm not doing good, I say, I'm tired, I'm not feeling good. Because we've had this kind of like forced like happiness. And our generation has honestly kind of done a better job, even if maybe sometimes we go a little too far in the other direction. And we need to normalize not being not okay, and being open about it is the particular thing. Being honest about it, because if you hide it, no one's gonna know what's going on unless you speak about it. And if not, you just seem like it just creates a disconnect, and it helps just reinforce this isolation that a lot of people with like depression, anxiety, and stuff experience.
Megan, could I just jump in just for a second? I just want to remind people that cultural change, any kind of cultural change, is glacial. It doesn't happen in miles, it happens in inches. And if you don't believe that, then look at the civil rights movement, look at the feminist movement, look at the LGBTQ community movement. The latest challenge there is the trans community. Many of you know that it's dangerous these days to be trans. The murder rates among trans men in particular are the highest in the country. So it tells you we have a ways to go. So what I would say about that is that those of us who are adults in the culture, we have a particular responsibility to help the younger generations come along. I know this firsthand because I give a lot of talks in the community, and I'm want to talk about things plainly and without sort of sugarcoating it. And I don't always get a great reception. And yet I feel like it's my ethical responsibility to talk plainly about what the mental health landscape looks like these days. Because if you can't turn and face the problem, you can't fix it. And so this is a special kind of invitation and ask, I guess, of the adults, both listening and in the room, to take responsibility for advancing a more progressive social agenda, at least in terms of these issues. Because I think that's what these kids are doing today. They need the help.
I just want to chime in really quick on the question asking about stigma and reiterating what everyone said here. It really comes down to two elements of smashing the stigma, and I think that's education and storytelling. What we all did today was share our stories to help break that stigma and smash those barriers down that we can't talk about mental health. And then also all the statistics. So all the statistics you see out here today, like educating, leaving here and sharing with others, like the prevalence and how much of an issue this is.
Just to add on really quick, I think another big element of that is acceptance. I know a lot of people in the older generation tend to ignore mental health and mental health awareness, mostly just because it wasn't part of their generation. It was never a topic discussed, and it was never an issue discussed. So when parents, grandparents, anyone, or guardians, whatever, if you take the time to just sit down and be like, yeah, this is a thing and it needs to be addressed, that's already taking a huge step forward, because just accepting that it's something that needs to be changed is already working towards change.
Just a little quick. um, yeah, all that being said, that was really good. And the way that I know we for sure can carry this like out and keep talking about it is to leave here and talk about it, and to make it something that isn't so hush hush or taboo to talk about. Like, we don't talk to each other as an adult therapist or professional talking to a child who struggles. We talk as people. We talk and we give each other advice, and we accept each other, and we communicate. And that's the biggest part. It's communication and carrying it out and not being afraid to carry that out.
Thank you. And you know what? We'll actually piggyback off of that and let everybody know that this is being recorded today. And we really hope that you share it and you help us share the message of our wonderful students and our panelists today. And really continue this dialogue through sharing these normal is overrated conversations. And we are looking into a podcast. Thank you, Deb. Thank you, Deb.
You're such a compelling person, Deb. Absolutely. That's right.
If only more of the younger generation actually listened to podcasts.
Listen, my verbal memory is
I
terrible.
think
I'll
more,
forget half of it.
I think more of the younger generation would listen to podcasts if it was put on by younger people. They don't want to hear me. Kids don't want to hear me talk about anything, but they will hear their peers talk. Oh, let me tune in to hear Cass or Zoe. So yeah.
Great. Thank you. So, and I see people in the chat saying a podcast. Yes. So it looks like that may be in the future. And this is a pretty practical question. Do we have a flyer that we can put in classrooms? A teacher is actually asking.
Yes, in Lee County Schools, we do have a Google Classroom that we put together at the beginning of the year that talks about trauma and resiliency and mental health. We put together a training that was viewed and showed at all of our schools. And in that Google Classroom, there's actually a how-to kind of one pager that we call them. And it talks about how to respond to students who have experienced trauma and mental health and what you can do as a classroom teacher. So if that person happens to be in Lee County, they can go into that Google Classroom and print that out.
Thank you. And actually, they are a charter teacher. So for charter teachers, and we are looking for more geared towards the contact information for these students and how to get involved in Fort Myers Progress Panel. Is there a flyer that we can send out to some of the charter teachers or any of the Lee County school teachers?
So actually Dominique and Grace, I believe, created a flyer for the weekly group. And we're all kind of connected. So if you reach out to anyone about anything, the Fort Myers Progress Panel, you can pretty much be easily linked to the whole setup, the whole Kids Minds Matter and everything that we offer. I'm connected to Sherry, so it's just one email or a text message away. But that we can get that email, that flyer for the weekly group. Can we get that redistributed to teachers?
Absolutely. I would be more than happy to email it to you. And it's, I think it's really good. It's a real good, what we call pictogram. So
Just real quick, there is an Instagram that you can go through. I'm sure someone can put it in the chat. It's Fort Myers Progress Panel on Instagram, which I believe Dominique and Grace run, which you can reach out to them on that and get connected to stuff. I believe all of us also follow it. So if you just search up our name and followed, you can reach out to any of us as well, and we'd be happy to talk to you about it. But it's very widely accessible. So if you just dig a little bit, you can find it and reach out.
Yes, I just want to add we do have an Instagram, like Zoe said. We also have a Facebook and a website. You can just search up www.info.fortmyersprogresspanel.com. Will come up, and our email is on there. So if you have any more questions, just feel free to email us and we can get you the resources that you need. Thank you.
Okay, yeah, we are definitely going to try and get some of these resources in the chat out to you shortly here. Abby, were you able to let your teachers and students know that you suffer from Tourette's? If so, how?
Yeah, kinda. I remember when I was really little, like first or second grade, my mom actually came to the school and she was like, "Hey, it's not cool that you're bullying my kid. She has Tourette's." And she kind of explained what it was. But, as I got older, I'd try to explain to the teachers what's going on, and they really wouldn't understand, or they'd think I'm lying and just making it up to like get out of class, or because, sometimes I'd have a really bad attack coming on and I need to step out, and they're like, "Oh no, you don't really have Tourette's. You're lying." But, when I got to some of the worst ones where like I'd bang my knees together so hard, I had bruises going up and down my legs, or like the ones that are super noticeable, they either thought I was just really annoying or they were like, "Oh, I guess this kid is for real." Who would have thought? But kids, even if they know what you have, they still don't really accept it. Like I used to wink at people and people would always be like, "Why are you winking at me?" I'm like, "I'm sorry." But kids and teachers, they judge a lot, but you get that one teacher that's really understanding and can kind of help you throughout the day. Like they help you with your accommodations and they ask you how you're doing. And if you need to step out, they let you step out. So it's just really important to focus on the people who do understand and don't like mock and make fun of you. Um, you really need to focus on that instead of the kids that are still making fun of you and teachers who still think you're faking it.
What a courageous and challenging story that you have. Thank you so much for sharing that and inspiring ways we can communicate and really painting the picture of what that feels like when you feel often misunderstood by your peers, by your mentors, and your friends. Now, we do have somebody in the chat that spoke to, as a parent, dealing with a child with mental health issues, them also having mental health challenges. And not knowing where to go to navigate their own mental health challenges so that they could better lead the way for their children. Dr. Simeone, is there any resources that we have here in Lee County, like Healthy Minds, so to say, that you'd like to speak to?
Well, Healthy Minds, as was said earlier, was an initiative that we set up at the beginning of COVID, really to reach out to the community, to do free behavioral health screenings, to provide resources in the form of a resiliency toolkit and referral through United Way 211. So that person can get on, just speaking to you directly, you can get on the Healthy Minds website and you can download both the resiliency toolkits. There's a lot of resources in there. And there's also a screener for depression, anxiety, and substance abuse, which you can take online. And if you want to discuss that with anybody, especially me, I'd be happy to do that. So in terms of getting help for yourself, there are a number of places to go. We at Lee Health have an outpatient behavioral health clinic that people can come to. Elite DNA has been mentioned already. And if you want access maybe to free behavioral health services, you might call United Way 211, because the last time I checked, Catholic Charities was providing free psychotherapy. And so those are just a few resources that you can start with. And my guess is that you'll find what you're looking for. Hope that helps.
That's perfect. We have one last question, and then that will conclude our question and answers portion of today's event. All of our panel speakers today talked about their journey towards healing, and you spoke about pivotal events in those journeys, moments where you realized you needed to seek help. What was your most important part? What was the most important first step for you in seeking help?
Specifically for me, the most important like first step of seeking help is acknowledging that you need it and that it's okay to ask for help. Because personally, me, my dad, my mom, we like to do things on our own. We like to be self sufficient. We like to handle things ourselves and not bug other people. But mental health is not something that you can necessarily be self sufficient for. It's okay to ask for help. And once you realize that maybe, this is a bit too much for me to try and handle on my own, you can you can ask yourself, what do I need to take a step forward into the healing process? Because it is a process, especially even for parents too. Like understanding and helping your child heal is going to be really difficult for you, and I'm not going to sugarcoat it. It is total hell. And I props to all of the parents that are there to support their children. You are absolutely amazing, and all your kids are so grateful for you, even if they don't show it. But yeah, definitely just accepting and realizing that you actually need help was a really difficult part of the healing process, because you want to pretend you're okay and you want to pretend that things will magically get better, but they don't. You sometimes need therapy, you sometimes need medicine, and you definitely need support. So yeah.
And you said it earlier, you'll feel better when walking out than you did going in. So kind of reiterating that message.
Yes, it is terrifying to acknowledge that you need help and you need to make a change. It is absolutely terrifying, and it is stressful and it's overwhelming, but eventually you're going to be better for it and stronger from it, and you will be altogether a more full person, like mentally and physically. You will feel better about yourself. You will be able to realize that I can get through this. I am a strong person and I am able to do whatever I set my mind to do. So you just kind of need to focus on that, and like the affirmations, be proud of yourself for trying, even if no one else is.
If I may add on to that, it's interesting because in my case, my first step was actually my doctor sending me to go see a mental, I think it was like a psychologist or something, to go get like diagnosed, do screenings. After I had a breakdown discussing my weight, that was fun. But it wasn't really acknowledging that I needed help. That was the biggest part for me. It was acknowledging that I actually do have a problem and that it's not just me attention seeking. Because I truly felt in the week before receiving my diagnoses at first, and even before my ADHD diagnoses, I kept on worrying, oh, what if I'm just being an attention seeker and I just want all these problems so that people feel bad for me, or so that I have these excuses for how lazy I am. We have a lot of these issues with kids who do sometimes think of the wrong things. It's typically not attention seeking, though. It's typically not. It's, for the most part, it's not. And if it is a kid attention seeking, then they do have problems as well. It just might not be those.
Right. They say that if somebody seems like they're attention seeking, well, maybe we should give them that attention.
Yeah. And it's also better to give the benefit of the doubt first, either way, especially with ourselves. But it was really, that was the biggest step. And also changing my thought process on my view on myself was the biggest part. And I engage in a lot of cognitive behavioral therapy to do that, because we don't recognize how much the repetition of the same phrases against ourselves, like, oh, I'm stupid. Oh, I'm just a joke or something like that. Repeating that over and over again is going to make you believe that. You need to speak kindly about yourself, or else you're not going to believe kind things about yourself.
Thank you, Megan.
Um,
Cass, did you want to add to that?
Indeed. I believe that the first step isn't always forward. Like maybe, the way I've only recently started healing. And the way I had to see it was instead of pushing all these emotions away and denying them and deciding to just not feel them, I had to take a few steps back and kind of sit in them and accept them and understand that they're real. And without noticing them, you can't get better if you don't want to, if you're in denial of things. So once you take that step back and you see that these are real, then you can get up and take the step forward, because it's not going to work if you're not accepting.
Thank you. And for anyone that's still in the room today, thank you. Thank you for being here. Thank you for asking questions. And if you have any more questions that come up after this event, you can email the Fort Myers Progress Panel. I know we dropped you're out of my line of sight over there. So we have one more question.
So I just kind of want to add, I know for me personally, it took me hitting absolute rock bottom for me to realize I kind of needed help. Like, I had no friends. I went completely selectively mute. I only ate once a week. I dropped 40 pounds. Life was miserable, and I didn't really know I needed help till I kind of told my mom about it, and she was like, "Hey, that's not normal." I was like, "Oh." And it's okay if you're not ready to heal yet. Like, even today I still struggle with things. Like earlier today, for example, I was having my mom hype me up so I can go sit next to Megan cuz I need friends. But it's okay if you're not ready to heal yet. You have to give yourself time, you know?
Abby, I will totally be friends with you.
Me too.
Friend group.
Thank you, everybody. That concludes our question and answer panel portion of the event. We will have a couple of closing remarks from Dr. Simeone before we close out today.
Well, thanks. And thanks everybody for participating in this. Thanks to those of you who are watching at home. I often wonder what I should be saying at the end of something like this. And I've been thinking for the whole morning. There's a line from one of Bruce Springsteen's early songs that says, "And the poets down there don't write nothing at all. They just stand back and let it all be." And so I don't think I need to say a whole lot more, except thank you to everybody. Thank you to Carly and Domini and Grace for all that you've done. Thank you to our students. Thank you to the panelists. Thank you to everybody who put this together. Really, we have to just keep on keeping on. It's all about doing what we can to reduce mental health discrimination, raising awareness, helping people get to a place that is going to help them live and suffer less. So thanks everybody again for being here. It's been wonderful. Be well, everybody.